Okay, hello everyone. So for today I am going to start with some another topic that will be related to renal disorder. So today I am going to talk about nephrotic syndrome. So first I will be talking about small case study related to nephrotic syndrome. Then we will look into the laboratory finding, and then after I will be explaining the biochemical basis of the changes which we see in nephrotic syndrome. Okay. So the first part will be small case study. Then I will be talking about the laboratory finding. Then I will be dealing with biochemical basis of the changes which we see, basis of changes seen in nephrotic syndrome. And I will be also telling about the mnemonic, and the shortcut formula to remember the the peculiar finding which we see in nephrotic syndrome, and the matter related to the causes of nephrotic syndrome. So now starting with the first point, that is case study. So I will be writing here the small case study related to nephrotic syndrome. So the case study start with a boy of 5-year-old. So the age of boy was 5 years. Visited OPD with complaint of puffiness of face, edema of leg, and reduced urine output. So the key word here is, there was complaint of puffiness of face, so that there was facial swelling or facial edema, and there was pedal edema as well. So there was swelling in the legs also, and there was reduced urine output. So on the basis of this examination, physical examination, the clinician orders certain laboratory tests. Okay, so the urine sample as well as the blood sample was collected for certain investigation. So let's look into the finding, what was seen after urine and blood examination. So urinary spot urine sample for protein. So there was test for protein and it was strongly positive. It was +4. So there was appearance of massive protein in urine. So blood +4 suggests urinary protein around 1000 mg per dl. So in 100 ml of urine there was presence of more than 1000 mg per dl of protein. So there was appearance of massive protein in urine. So there was massive proteinuria. And on blood examination there was elevated level of there was serum albumin was around 2.5 gram per dl. So there was reduced serum albumin, the normal range being 3.5 to 5.5 gram per dl. So there was decreased serum albumin, that was around 2.5 gram per dl, and the serum total cholesterol was around 350 mg per dl. So there was increased serum cholesterol level. So there was hypercholesterolemia, and the normal range, as all of you might be knowing, of serum cholesterol is around 150 to 200 mg per dl. So there was increased level of serum cholesterol. So on the basis of this physical examination and the laboratory finding, a diagnosis of nephrotic syndrome was made. Okay, so as you can see, the main finding or nephrotic syndrome is characterized by 4 tetrad. Okay, so that is the 4 peculiar finding which we associate with nephrotic syndrome. So what are those 4 findings and the peculiar finding which we see in nephrotic syndrome patients? So there is mnemonic to remember this tetrad, that is a characteristic feature of nephrotic syndrome. So the 4 tetrad can be remembered with the help of mnemonic, that is PALE, P-A-L-E. Okay, so PALE, P stands for P here stands for proteinuria. Proteinuria, and technically we can call it as a massive proteinuria. So there P stands for proteinuria. So there is increased amount of protein in urine. So there will be increased loss of protein in urine, and you should remember protein is not a normal component of urine. It's an abnormal component of urine. So in normal individual, protein is excreted in very less amount, and that is beyond detectable limit. We can't detect that amount of protein. But in case of nephrotic syndrome, there is massive proteinuria. So that is one of the peculiar findings which we see in nephrotic syndrome patients. So it is said that nephrotic range proteinuria, if we take 24 hours urine sample and if we estimate protein in that, so that in generally in those patients, nephrotic syndrome patient, that comes around greater than 3 gram per day. So there is a massive proteinuria. So 24 hours urinary protein amount in nephrotic syndrome is greater than 3 gram per day. Now A stand for the P mnemonic stand for proteinuria. So the first characteristic or the tetrad that associated with nephrotic syndrome, that is the peculiar finding, that is proteinuria. There is a massive proteinuria, so there will be appearance of greater than 3 gram protein per day in urine. Now A stands for albumin, so there will be hypoalbuminemia. Hypoalbuminemia, that is decreased serum albumin. Okay, and the normal in those patients generally we see the serum value of serum albumin value of less than 3 gram per dl in nephrotic syndrome case. Now the P stand for massive proteinuria, A stand for albumin, that is hypoalbuminemia. Now coming to L stand for hyperlipidemia. L stand for hyperlipidemia, that is increased level of serum cholesterol and TG. So there will be increased total cholesterol and TG, triglyceride, in serum of nephrotic syndrome patient. Now the fourth one, last one is E. E stand for edema, that is swelling, and there is an accumulation of the fluid in the interstitial tissue spaces. And edema pattern what we see in nephrotic syndrome is it is generalized edema. So edema can be seen throughout the body, and in medical term we call it as anasarca. That is called anasarca. That is the term which we use for generalized edema. Okay, so what is the basis of this finding or the peculiar finding which we see in case of nephrotic syndrome patients? So remember, it is associated with 4 tetrad. The first is proteinuria, the second one is hypoalbuminemia, the third one is hyperlipidemia, which is associated with increased level of total cholesterol and TG in serum, and the last one is edema, which is generally generalized edema, and in medical term we call it as anasarca. So these are the 4 prominent findings which we associate, or the characteristic finding which we see in nephrotic syndrome. So now coming to the biochemical basis, why there is a proteinuria, why there is an appearance of protein in urine. So now I will little bit I will talk about renal physiology. So you can know that generally protein in urine appears in very small amount, and that too beyond detectable limit, because there is there is glomerular membrane. So there is glomerular membrane, so which act as which doesn't allow the filtration of protein. So protein are are not able to get filtered across this glomerular membrane, and this glomerular membrane is made up of three main components. So the glomerular membrane is made up of three main components. So there is endothelial cell, there is glomerular basement membrane, okay, GBM, that is called glomerular basement membrane, and there is podocyte, that is the epithelial cell. So what happens during nephrotic syndrome is there is damage to this glomerular basement membrane, which have both charge selectivity and size selectivity. So this glomerular basement membrane doesn't allow the protein to filter across it. So the protein is retained in plasma. Normally it doesn't appear in urine. So what happens if there is a damage to the glomerular basement membrane or this podocyte, that is the epithelial cell present in the glomerular membrane? So what will happen? That can cause leakage of protein. So there will be increased permeability of this glomerular basement membrane and this podocyte, and obviously that can lead to massive proteinuria. So the important point here you should remember is during nephrotic syndrome there is damage to this glomerular basement membrane and this podocyte, which can lead to excess filtration of the protein, and this protein will start appearing in urine, and that is what we see in nephrotic syndrome. Okay, so that is the most common cause of proteinuria, that is damage to this glomerular basement membrane and the podocyte. Now coming to why there is hypoalbuminemia. So hypoalbuminemia, obviously if there is excess loss of protein in urine, so the major protein which is present in plasma is albumin. So obviously if there is excessive loss of protein in urine, so albumin will also it will increase, or there will be increased amount of albumin in urine, so that will lead to decreased level of serum albumin. So proteinuria, heavy proteinuria result in decreased albumin in serum, so there will be decreased albumin. So the hypoalbuminemia basis is easy to understand. Why there is hypercholesterolemia, since or hyperlipidemia, since you can see there is a massive loss of protein, and protein is excreted, is getting excreted in large amount in urine. So liver will try to compensate for the loss of protein by synthesizing more amount of proteins, including the there will be increased synthesis of lipoproteins by liver. So these lipoproteins are synthesized in more amount by hepatocyte, resulting in increased level of LDL cholesterol or VLDL cholesterol, and ultimately that will increase the level of TG and cholesterol in blood. And the most important point is why there is edema. So in examination and all, they ask the biochemical basis of edema in nephrotic syndrome patients. So what is the biochemical basis of edema? So the reason being, since albumin, serum albumin is reduced, and this serum albumin is responsible for maintaining the oncotic pressure of the plasma, which is around 25 mmHg. So reduced oncotic pressure will result in accumulation of the fluid inside the interstitial tissue spaces, or we can say there is an exudation of sodium and fluid in interstitial tissue spaces, resulting in edema. So the main reason being albumin is responsible for maintaining the oncotic pressure. Since albumin value is reduced, so oncotic pressure, which is responsible for the maintenance of fluid within blood vessel, will also get reduced, and ultimately what will happen? There will be more exudation of salt along with water inside the interstitial tissue spaces, resulting in generalized edema, or in medical term we call it as anasarca. So that is the reason for hypoalbuminemia in nephrotic syndrome. Coming to the causes, the major causes of this nephrotic syndrome. So there are two types or the two etiological causes. One is primary cause and the second one is secondary cause. So primary cause is related with the glomerular disease. Okay, so there is a direct damage to the glomerulus. So what are those causes associated with nephrotic syndrome? The first cause is minimal change disease. Minimal change disease, that is mostly seen in early childhood, around children who are 1 to 7 year old. There the main cause of nephrotic syndrome is minimal change disease. The second cause is membranous glomerulonephritis, and that is mostly seen in elderly individual. In adulthood, this is the most common cause of nephrotic syndrome. Other cause being, there could be rapid progressive glomerulonephritis. That could be also be one of the cause of nephrotic syndrome. That is the primary cause, and there could be also focal segment glomerulosclerosis. So these are the primary cause of nephrotic syndrome. So the most common cause of nephrotic syndrome in children, that is in the age group between 1 to 7 years, is minimal change disease. Then in adulthood, in later stage, it could be due to membranous glomerulonephritis. There nephrotic syndrome can also be caused due to rapid progressive glomerulonephritis, and nephrotic syndrome is also seen in the cases like focal segment glomerulosclerosis. So these are the primary cause. Secondary cause is related to there is mnemonic for that also. So the mnemonic for secondary cause is this lad has nephrotic syndrome. So the mnemonic to remember the secondary cause of nephrotic syndrome is this lad has nephrotic syndrome. So T stand for tumor. So it could be seen in tumor related to that has hematologic basis like leukemia, or it could be seen in multiple myeloma, or it could be seen in lymphoma, or it can be seen in solid tumors like in colon cancer, or in case of lung cancer, or in case of breast cancer patient. So that is the most common cause in elderly individual. If the primary cause is ruled out, the most common cause in elderly individual of nephrotic syndrome are tumors. So it could be both hematologic origin, or it could be due to solid tumors. Then the H stand for it stand for heavy metals. So there could be heavy metal which can induce nephrotic syndrome. That could be due to mercury or lithium, or it can also be due to certain non-steroidal anti-inflammatory drugs. So that drug toxicity can cause nephrotic syndrome. I stand for infection. So there are various kind of infection which are associated with nephrotic syndrome. It could be seen in hepatitis B, hepatitis C, or in case of syphilis, or in case of subacute bacterial endocarditis. So there are so many causes associated with infection. S stand for again subacute bacterial endocarditis. So that is one of the main cause, secondary cause. L stand for this lad. Remember the mnemonic. This lad has nephrotic syndrome. L stand for lupus. That is SLE, systemic lupus erythematosus. That could be also one of the systemic cause of secondary cause of nephrotic syndrome. A stand for, that can be due to AIDS also. HIV person can also get infected, that there could be renal involvement in AIDS patient also, HIV patient. So that can be also one of the secondary cause of nephrotic syndrome. D stand for diabetes. Okay, so diabetes individual due to diabetic nephropathy, there could be change in glomerular basement membrane, and that can result in nephrotic syndrome. Okay, and these are the major mnemonic. Okay, this slide will cover almost all the part. That is, T stand for tumor, H stand for, there could be heavy metal poisoning or due to drug induced toxicity, especially associated with non-steroidal anti-inflammatory drug. I stand for infection, that could be due to hepatitis A, hepatitis B, HIV or syphilis. That could be also cause secondary nephrotic syndrome. A stand for subacute bacterial endocarditis, that is also one of the associated infectious cause of secondary nephrotic syndrome. L stand for SLE, lupus, systemic lupus erythematosus. A stand for AIDS, and D stand for diabetes, that is associated with diabetic nephropathy. So I hope by today's video you must have understood about the peculiar characteristic feature of nephrotic syndrome along with the biochemical basis of the changes which we see in the nephrotic syndrome, as well as I have explained it with mnemonic related to the causes, primary cause and the secondary cause of nephrotic syndrome. I hope this video was helpful to you, and thank you all for joining me.